Our health. For decades now, researchers and health experts have issued warning after warning about the dangers of smoking. Despite the slew of information we have on the topic, tobacco and nicotine use continue all around the world. That's why earlier this month, lawmakers in the UK approved a lifetime smoking ban for those under 18. With new restrictions coming, new concerns about all this aftermath, joining me now for a deeper look at the potential impact is Dr. Mark Montano. Montano, am I saying that correctly?
Yeah.
No, what is it?
Well, I always say like the state, but ends in an O, Montano.
Montano, we got to get it right, okay? He's the medical director of Care Now Urgent Care. Thank you so much for being here.
Of course.
So first and foremost, can you remind us all, I feel like people forget what the biggest health concerns are in regard to smoking, especially those who are under 17 years old?
Yeah, well, gosh, that is such a big question, and there isn't a single answer. But really, for the younger people, the people who, are teens, their brain isn't fully developed. And we know nicotine is much more addictive in those younger age ranges. So the biggest risk for teenagers is that once they get addicted, it is much harder to quit than if their brain was fully developed at about age 25.
So what do you think this new, legislation law in the UK will do? Do you think this really will curb people 17 and under from never getting addicted to smoking?
Well, boy, that's a really good question. And New Zealand had a similar law, and that was struck down. It was a little different, but it was a generational ban, and that's really what this law in the UK is. It's a generational ban. So at anybody 18 or under won't ever be able to legally age into smoking. And then next year, that'll go to 19, so anybody 19 and under. If that were to hold, we would see a significant health benefit from that generational ban.
That's interesting. I love how at the end of the day, the data shows us, right? Yeah. What about some of the states here in the United States? They've implemented some, reform. Have you seen any impacts there?
Well, interesting. A small town in Massachusetts actually has a generational ban. One small little town. It was upheld by the Massachusetts courts. And so we're really not sure what kind of an impact that will have. It's such a small area, it's hard to know.
Right.
So, but we do know that smoking cessation efforts are having a big impact. If we look at our average age of smoking in 2002, the average age was 15. We've put a lot of effort into educating teens about the risks of smoking. And if you look at 2018, 2020, that age has gone from 15 to about 16.7, 16 and a half years old. So we are seeing some benefit. And that's really where we want to see those changes in those in the young brains that are most susceptible to the addiction.
Agreed. And as a parent, I love hearing you that there has been some benefit there. What about vaping? That is a concern of a lot of parents. Are you seeing the pendulum swinging back the other way, that kids are being more informed about the dangers of vaping?
Yeah. Again, what we find is that most teens, their first introduction to tobacco products is through vaping.
Right.
So we're actually seeing an increase in vaping in those younger age groups. And we're worried that that's a gateway to what we call combustible, or your standard cigarette that you light and smoke. So vaping is not safe. It's not a safe alternative. It has all of those same risks, and the nicotine addiction is the biggest one.
And I want parents to hear that. So be aware and educate your children on vaping as well. Dr. Montano, thank you so much. Thank you for the wealth of information. We appreciate you.
Of course.
We'll be right